Most people operate under the belief that heart attacks introduce themselves with clear signs like severe chest pain, a numbing left arm, or a sudden dramatic collapse, which is the exact scenario typically portrayed in films and commonly anticipated by the public. But the reality for individuals over 60 is often much more dangerous because the most critical cardiac events frequently arrive silently and evolve slowly while you sleep without offering any warning, extra time to call for help, or a second chance at recovery. This reality tends to shock the patients I speak with in the recovery room when I explain that these fatal events are nearly always initiated by mundane, seemingly unremarkable actions performed right before flipping off the bedroom light. I have spent over 20 years standing at the operating table, opening chests, repairing damaged arteries, and holding hearts. And during those 2 decades, I have consistently watched the same preventable patterns repeat themselves among patients who were completely unaware of what they were doing to themselves each night. So tonight, I will guide you through 5 of those specific habits, 5 actions that are effectively loading the gun while you rest, before I show you how to safely unload it one evening at a time. So please stay with me because the insights in these next few minutes may be the most vital information you receive all year. It is a commonly misunderstood fact that your cardiovascular system does not simply power down when you fall asleep. It essentially just shifts into a different gear, where in a healthy state, your blood pressure should naturally drop by roughly 10 to 20% as your heart rate slows and your arteries relax as part of an essential biological maintenance routine you have relied on your entire life. However, once you are over 60, this system starts losing its reliability as your blood vessels stiffen and your ability to regulate blood pressure becomes less precise, leading to weakened protective hormonal signals and a much smaller margin for error, meaning that while your cardiovascular system uses backup mechanisms to adapt and compensate throughout the busy day, those defenses effectively go offline at night, leaving your body running on a skeleton crew. This difference is precisely why the window between midnight and 6 a.m. carries the highest statistical risk for stroke and heart attack among older adults. And these events occur not during the afternoon or morning rush, but in the quiet hours where no one is observing. Yet your daily habits are in full force. The crucial turning point that dictates what happens during those high risk hours is entirely determined by your pre bedtime actions, such as what you ate, the temperature you set, or whether you took your medication, decisions that feel entirely routine. So let's look at the habits, starting with the one that genuinely surprises my patients the most. Let me ask you what time you ate dinner last night and exactly what was on your plate. Because when I ask every patient this question, I find that many people over 60 are dining between 8 or 9 p.m. or even later, often consuming a full meal. Think pasta, rice, meat, or fried food, followed by some sedentary time on the couch before heading straight to bed. A cycle built from busy family schedules that you understand, but from a heart health perspective, this routine quietly harms you. A large late night meal is one of the most underrated stressors on your heart because your digestive system suddenly demands a massive increase in blood flow to break down that food, which forces your heart to pump harder while triglycerides, the fats in your bloodstream, spike sharply within a few hours of eating. And when you combine this with lying down to sleep, your heart is forced to pull a double shift, managing active digestion while it tries to initiate its nightly recovery mode, a direct conflict that, in anyone over 60 with even moderate arterial stiffness, leads to serious consequences. Scientific research has consistently linked eating within 2 to 3 hours of sleep with elevated nighttime blood pressure, acid reflux that can mask or trigger cardiac issues, and a higher risk of nocturnal heart events. So the remedy is straightforward. Aim to finish your main meal by 6 or 7 p.m. And if you must eat later, stick to something very light like lean protein and vegetables to avoid heavy fatty foods. And if your current dinner schedule aligns with that stressful pattern, do not underestimate how impactful this adjustment can be for your heart. I need you to pay extremely close attention to this next point, as it involves where some of the most preventable harm happens. If you are over 60 and use medication for high blood pressure, as more than 60% of people in this age bracket do, then the specific timing of those pills matters significantly more than many physicians take the time to communicate. While your blood pressure usually follows a standard daily rhythm of morning rises and evening falls, a substantial portion of the population over 60, specifically those dealing with hypertension, fails to see that expected drop and instead stays elevated or actually surges in the early morning hours, a condition termed nocturnal hypertension. This is rarely discussed, yet it is uniquely dangerous because your arterial walls aren't prepared to handle pressure spikes at 3 a.m. the way they might handle a mid afternoon surge, making these nighttime spikes much more likely to rupture vulnerable plaque, initiate a clot, or land someone on my operating table. And if your blood pressure medication is only dosed in the morning, it may well have worn off when your body needs it most, or if you forget it, you are left completely unprotected during those most vulnerable nocturnal hours. You must speak with your doctor specifically about medication timing, asking if an evening dose is appropriate for your situation, because this simple 2-minute conversation, supported by evidence like the Haya chronotherapy trial, has the potential to save your life. Yet it is a conversation that most people over 60 have never had. So never assume the timing is irrelevant in cardiology, because timing is often everything. Now think about the people you know who snore, perhaps your spouse, a parent, or yourself, and that loud, irregular rumbling noise, which most dismiss as a simple annoyance or a reason to poke someone in their sleep. As someone who treats heart disease for a living, I treat chronic snoring as a serious clinical warning sign until proven otherwise, because sleep apnea is one of the most chronically underdiagnosed and underestimated health threats facing adults over 60. It is estimated that more than 30% of seniors suffer from some level of sleep apnea, yet the vast majority remain untreated and entirely unaware of the cumulative toll it takes on their heart each night. When you experience a sleep apnea episode, you might stop breathing for 10 to 40 seconds, potentially repeating this dozens of times an hour, which forces your oxygen levels to plummet, triggering your brain to hit the panic button and release adrenaline and cortisol, sending your blood pressure and heart rate spiking while you are still in a sleep state. Imagine this cycle of the heart being jolted awake while the rest of the body is inactive, repeating 40 or 50 times a night. It is incredibly punishing, leading to a threefold increase in heart attack risk, as well as connections to irregular rhythms like atrial fibrillation, a stroke increasing condition that directly accelerates arterial stiffening. Most people have no idea they are suffering from this until a major event occurs, so keep an eye out for signs like waking with morning headaches, persistent exhaustion, frequent nighttime urination, dry mouth, or gasping for air upon waking. If any of these sound familiar, insist on a sleep study, because for a patient over 60 with existing heart concerns, treating sleep apnea, typically with a CPAP device, is not optional but essential for survival, leading to measurable drops in blood pressure and lower cardiac risk. So please take a good hard look at whether you or your partner have these signs and do not brush them off. We must also address another habit rooted in logical but flawed thinking, intentionally drinking less in the evening to avoid night trips to the bathroom. While preventing interrupted sleep is valid to reduce the risk of falling, becoming even mildly dehydrated before you lie down is a massive, often ignored cardiovascular risk, because when you are dehydrated, your blood becomes more viscous and thicker, meaning it cannot travel through your blood vessels with the same ease. For younger individuals, this might just be a nuisance, but for someone over 60 with pre-existing arterial plaque, thicker, slower moving blood in narrower vessels significantly boosts your risk of forming dangerous clots. Consider that during sleep, both your circulation and heart rate naturally slow down, so you are taking thick blood, slowing it further while the body remains motionless for 7 or 8 hours, which perfectly sets the stage for those early morning cardiac events we see so often. The fix is wonderfully simple. Drink 1 glass of water before heading to bed to prevent your blood from turning too thick. Keep another glass on your nightstand and listen to your body when it tells you it needs water at 2 a.m., because you shouldn't have to choose between sleep continuity and heart protection. There is one more surprising habit, which seems almost too basic to matter. But ask yourself about the temperature of your bedroom. Most people view this solely as a question of personal comfort, failing to realize your cardiovascular system functions at its peak within a very specific thermal range. When your room gets too warm, above 22 degrees or 72 car, your body exerts continuous effort throughout the night trying to shed excess heat, forcing your heart rate up and blood vessels to dilate while causing sweating that worsens dehydration, all of which degrades your sleep quality and prevents the deep restorative rest your heart desperately requires for nightly repair. Conversely, a bedroom that is freezing, typically below 16 or 17 degrees, triggers the opposite problem of vasoconstriction, where your vessels tighten to preserve core heat, directly driving up your blood pressure and forcing your heart to work harder to push blood against that increased resistance. The optimal setting for sleep and heart health sits in the middle, between 18 and 22 Seudusha, where your body stays thermally neutral, vessels remain relaxed, heart rate stays steady, and your recovery remains uninterrupted. So do not underestimate that thermostat setting as a genuine protective measure. Everything I have outlined might feel like a long, overwhelming list, but if you reframe it, these 5 points actually constitute a practical, achievable, heart safe evening blueprint that fits into any normal life without massive, unmanageable overhauls. Let's look at the routine. Between 6 hot and 7 hours p.m., consume your last meal, opting for lean protein, plenty of vegetables, and moderate carbohydrates rather than a heavy feast, giving your heart roughly 3 to 4 hours to finalize digestion before rest. Then around 7 p.m., attend to your fluids and your medication schedule. And if Dr. William hasn't personally sat down to discuss the exact timing of your blood pressure drugs, consider this your call to action to do exactly that, as it is a crucial conversation that provides significant extra protection for many. By 8 mon or 9 p.m., start a deliberate wind down period that includes gentle movement, reading, and moving away from blue light emitting smartphone screens, which suppress melatonin and keep your nervous system in an alert, active state far past its natural time to rest. At 9 p.m., set the stage for your night by adjusting that thermostat and ensuring a glass of water is at your bedside. These rituals take less than 2 minutes total, yet their impact is compounding. By 10 p.m., try to be in bed, and for one extra tip that costs absolutely nothing. If you deal with snoring or have been told you pause breathing, switch to sleeping on your side instead of your back, as back sleeping is well documented to aggravate airway obstruction, making simple repositioning a key tool to manage those breathing pauses while you organize a professional medical assessment. It is not a question of whether these steps are effective. The science unequivocally confirms that they work. The question is purely whether you will prioritize them in your own life. Now, let me speak directly to you as a surgeon rather than just an online creator. I have personally stood in the operating room at 3 a.m. holding a heart that failed entirely because a small, avoidable blood clot formed during the night inside a restricted artery, and I have had to look at families sitting in dark waiting rooms at dawn who, just hours before, thought they were saying a normal goodnight to a healthy loved one. I have looked over the autopsies of people who, mere days prior, were full of life and planning parties, and in nearly every single instance, the factors were not exotic or rare. They were standard, everyday life factors. A late meal, a missed pill, an overheating bedroom, quiet dehydration, or undiagnosed apnea. These aren't uncommon, bizarre risks. They are simply the background noise of modern life, but that noise repeated over decades eventually manifests as the heart attack no one saw coming because they never knew where to look. More than 2 decades of surgical work has taught me that the hearts I repaired generally fail not due to bad luck, but due to information that was simply missing. The patient never knew, so they never acted. You have that missing information now, and the only remaining question is what you choose to do with it. Starting tonight, not next week or after your next appointment. Do it tonight. So, to recap the 5 habits and 5 solutions. 1, finish your main meal between 6 and 7 p.m. It's not a strict diet, just a sensible timeline. Two, consult your doctor regarding medication timing to see if an evening dose is the safer move for your biology. Three, if you snore, are always exhausted, or are told you stop breathing, do not treat this as optional. Get evaluated for sleep apnea immediately, as it is vital cardiac care. Four, keep a glass of water at your bed and drink it before resting, so your body doesn't deal with the fallout of thickened blood overnight just to avoid one trip to the bathroom. Five, maintain a comfortable bedroom temperature of 18 to 20 centigrades to prevent cardiovascular strain. This simple habit is free and effective. I genuinely appreciate your contribution, so tell me in the comments below, how many of these habits do you recognize in your own current routine? Because if you are nodding along right now, you are certainly not the only one, and identifying that connection is the exact step needed to change your outcome. If this video resonated with you, please share it with your spouse, your siblings, your friends, or anyone over 60 who has never once connected their bedtime routine with their heart health. They need to see this. Treat your heart with care because it has been beating faithfully for you day and night through your whole life, and it deserves the optimal conditions to keep going for many more years. So bear in mind that while everything I have provided today is grounded in medical research and clinical experience, it remains general education and is not a substitute for your personalized doctor's guidance, especially concerning medication changes. So consult your own physician before shifting schedules, not as a legal warning, but as sincere advice from Dr. William, someone who genuinely wants to see you watching this channel and living a long, healthy life 10 years from now. So good night, sleep well, and starting right now, take good care of yourself.